to, and we remember all those NHS staff who've died, so too we do for those who serve our country and look after people in social care. He asked about the question about the relative, the international comparisons on the number of deaths. Of course, this needs to be done scientifically, taking into account the size of the populations of different countries. And it is, there is an important analysis that we're constantly doing of why the death rate as a proportion of the population in Germany is lower. It's something I speak to my German counterpart about. That we look at all the European countries where the death rate is higher, and we try to learn also lessons to make sure that we are doing the best that we possibly can here. There are many explanations for Germany, and one of them that the German health minister explains both in public and in private is the nature of those who first caught the disease in Germany. But there is analysis, there's an awful lot of analysis of why, and we're constantly looking at this question to improve our delivery here. He asked about the 7-day rule and the proposals through SAGE. SAGE, of course, is an advisory committee, and it advises ministers. We are guided by the science throughout this, and the science recommends the 7-day rule on returning to, well, it's not returning to normal by any stretch, but coming out of full-blown isolation once somebody has had the disease, if they no longer have symptoms. That is the scientific advice, and the basis on which that decision was taken was precisely as he says, that we listen to the advice from SAGE, and then we take decisions based on it. And that was one that was where we fully accepted the advice, as we do most of these clinical type decisions. He asked about expanding clinical understanding, because he's right that the primary and the biggest impact of this is on the this disease is on the respiratory system. It's not the only impact, I will seek to take up his suggestion that the key clinical figures are convened. I think that the Royal Colleges are doing this already, but I'll check that is happening. Similarly, on in the figures of those who died, we are indeed investigating that, and I will make sure that he has a copy of the results of that investigation as soon as it is concluded. It's a very important piece of work. In the same way that there's a disproportionate number of men who are badly affected by this disease compared to women, we need to look at all of these characteristics and make sure we have the full analysis so we can learn and learn how to treat. He asked about care homes. All deaths in care homes, of course, are those figures measure slightly different things at different time frames. It's very important to look at a rigorous analysis of the comparison of the three. Yesterday there was some debate about whether the ONS figures showed that the deaths, when you measure deaths outside of hospitals, were 40% higher. It turned out that wasn't true. It was comparing apples and pears, and the real figure is closer to 20%. So I would just caution him against comparing the headline figures without a true comparison of the underlying statistics. He asked about the testing of staff. I'm really pleased that we've managed to roll out this testing to staff in care homes. He's absolutely right that can helpfully be done through mobile units and through the home testing kits that are increasingly available, especially for care homes that aren't close to one of the drive-through centres. Although now we have 27 drive-through centres, we're increasing that number over the next few days. There's new drive-through centres coming on stream all of the time. He also asked about PPE supplies to care, quite rightly, and there is a new service that is coming on stream directly to be able to provide the PPE that care homes and domiciliary care, so care provided in people's homes, that needs. As I say, increasing this this supply has been a massive logistical undertaking, with over 1 billion items of PPE delivered so far. The couple of other questions that he asked. He asked about the amount of spare capacity in the NHS. There are over 10,000 beds currently free in the NHS. And we want to reopen the NHS to non-coronavirus symptoms and to patients with non-coronavirus conditions safely and carefully as soon as it's that they should come forward. If you think you might have a lump that might be a cancer, then you should come forward now and you will be safely and properly treated in the NHS. The same goes if you have a suspected heart attack or stroke. We have the systems in place to make sure that if you come to the NHS, you will be looked after and protected. And we will gradually reopen the rest of the NHS, for instance, to the sort of non-life-threatening elective surgery that the Honourable Member mentioned, as soon as it's safe to do so. But as he can see, the combination of having some spare capacity in the NHS and at the same time of having reached the peak of the virus means that we can now start to reopen the NHS. And part of that is encouraging people to seek NHS treatment when they need it. Finally, Mr. Speaker, he mentioned contact tracing and the app. The app is currently in beta trials and those trials are going well. But clearly an app to tell you who you've been in contact with if you test positive for coronavirus is helpful, but what we also need is mass contact tracing so that as we bring the rate of transmission down and the rate of testing up, so that everybody who gets tested positive, we can contact all of the people they've been in contact with, make sure they get access to support and they know what to do, and that way we can control this virus with fewer of the very extraordinary social distancing measures that have been in place.
I just hope we can speed a little bit more on the answer. I know you want to make sure they're thorough, but we have got quite a few to get through. I think it's twice as long as the question. That was the problem. Right. Can I now go to the Chair of the Select Committee, Jeremy Hunt? Jeremy Hunt.
Thank you, Mr. Speaker. The World Health Organization say that one of the 6 essential criteria for lifting a lockdown is that we should be able to track and trace every single new COVID case in the community. Can I ask the Health Secretary, will that be in place in the next 2 weeks so that when the Cabinet come to consider whether they want to lift the lockdown, they are able to do so in a way that's compliant with what the WHO are recommending? And will he appoint a big hitter from outside frontline politics to really make sure that this happens in a very short period of time, as he has very sensibly done with Sir Paul Dighton on PPE?
Secretary of State.
I'm grateful, Mr. Speaker. The answer is that we are ramping up our testing capacity and our capacity for contact tracing in a matter of weeks, and we'll have it ready to make sure that we can use that as and when the incidence of transmission comes down. It isn't as tied to the specific time. It is the effectiveness of test, track and trace to keep the reproductive rate of this virus down is determined by the incidence in the community, and our goal is to get to a point where we can test, track and trace everybody who needs it.
We're now going across to Philippa Whitford. Philippa Whitford.
Thank you very much, Mr. Speaker. Like all MPs, I would like to pay tribute to health and care staff across the UK. But particularly in view of the key role of care workers, will the Secretary of State undertake to ensure they are paid at least the real living wage in recognition of their contribution, as has been the case for some years in Scotland? Like everyone, I welcome the stabilisation of COVID cases, but does he accept that the testing and contact tracing must actually be in place before any easing of the lockdown to avoid resurgence and a second peak? So will he achieve 100,000 tests a day by next week? If not, when? And how accurate are the tests in light of the report of a 25% false negative rate? Now, I know the Secretary of State is a fan of phone apps, so I'm glad to hear him recognise the need to increase public health staff to both conduct and coordinate contact tracing. So will he reverse the 20% cut in public health funding in England since 2015 to ensure that they can be recruited now? Finally, when I raised the issue of asymptomatic spread on the 11th of March, he claimed it was rare, but it's actually about 50%. So how is he taking that into account in his COVID strategy?
Secretary of State.
Thank you very much, Mr. Speaker. The Honourable Lady asked a number of questions. Firstly, on the living wage, absolutely all health and social care staff in the UK are paid the living wage because that is the law. I'm very proud that we introduced the living wage and that has led to a significant rise in the pay of, especially of people in social care who were on the minimum wage previously. She asks about asymptomatic transmission. The evidence, the scientific evidence on asymptomatic transmission does show that asymptomatic transmission occurs. That is one of the very significant challenges that this virus presents. She also asked about test, track and trace. I absolutely agree that test, track and trace is a critical part of keeping the spread of this virus low. It is more effective the lower the incidence, the lower the number of new cases are, the more effective test, track and trace is. And we are therefore building now the capacity for that very large-scale contact tracing that is necessary to go alongside the large-scale testing, the 100,000, as I said in my statement at the end of this month, and also the technology that can help us to do that.
We now go over to Greg Clark. Greg Clark.
Thank you, Mr. Speaker. It's important that decisions should be informed by good advice. So has the Scientific Advisory Group in Emergencies, SAGE, advised on whether the 100,000 tests a day target is the right one?
Secretary of State.
Thank you very much. The target set at 100,000 was because that is what we estimated was needed. There was scientific advice provided into that target, but also what is practically achievable. As I said, we are ahead of our trajectory on capacity, but we need to make sure that demand increases. That is the increasing demand is about widening access to this testing. We did take scientific advice. I'm not sure whether that came directly through the SAGE route or directly from Public Health England, but of course these decisions are based on the science.
Jeremy Corbyn.
Thank you, Mr. Speaker. First of all, I want to just pay tribute very briefly to all those health workers, care workers, delivery workers, street cleaners, and so many other groups all over the country that are doing such an incredible job together with all the volunteers to deal with this crisis. I think it's an amazing moment in this country's history. However, Parliament's job is to hold the government to account, and the question I want to ask is quite simply this. The World Health Organization indicated that there was a danger of an epidemic from corona in January. They later declared it to be a pandemic. The Director General of the World Health Organization said in terms, the way of dealing with it is test, 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 in order to ascertain the levels of infection across our society. We didn't do that. The Secretary of State came to the House in January to say he was going to increase the amount of testing. It was raised with the Prime Minister on the 24th of February. It was raised again with the Prime Minister at a meeting we had, which he was present at in March. And he told us then the level of testing would increase. It's still nowhere near the level that is necessary. Can he assure us that there's going to be a really rapid increase in the level of testing and the availability of testing to get on top of this dreadful virus?
Secretary of State.
Thank you, Mr. Speaker. The development of testing has been at pace throughout this crisis, entirely contrary to the story told by the Right Honourable Gentleman. We were one of the first countries in the world to develop a test. We rapidly increased the number of tests to 2,000 at the start of March to 10,000. That's a multiple of 5 times during March, and now going up further. This is an area where we've had our foot on the gas all the way through because it is incredibly important.
James Davies. James Davies.
Thank you, Mr. Speaker, and I'm grateful to the Secretary of State for his statement. Would he kindly update the House on the provision of a new COVID testing site in North Wales and the UK Government's role in delivering this in the context of devolution?
Secretary of State.
Thank you very much, Mr. Speaker. Yes, testing is an area where there are the government here, with the support of the devolved authorities. I think making sure that there's testing available in North Wales is incredibly important. And as it is right across the country, especially so that people can get access to those tests as he has said. I'd also mention the home testing, which will be done through the post, which of course will also be available, especially in more rural areas, that, like his constituency, that might be one of the most effective ways for people to be able to get access to testing.
We're going across to Hilary Benn. Hilary Benn.
Thank you very much indeed, Mr. Speaker. It seems increasingly likely that part of what will be required to tackle this virus in future will be the wearing of masks by members of the public in certain situations. If the government comes to the point, based on the scientific advice, that that is recommended, is the government's policy to provide masks to the public? And if so, what is his plan to source them, given the difficulties we have seen with PPE supply? Or will members of the public be expected to source their own?
Secretary of State.
We'll follow the advice. We'll listen to what the SAGE advisory group says on masks, and then we will implement that. I can't promise that we will give everybody free masks. I mean, that would be an extraordinary undertaking, and we do have to make sure that we have supplies available, especially for health and care staff, where the scientific advice throughout has been that the wearing of masks is necessary in those circumstances, and we've got to make sure the provision is there for them.
Going over to Chris Grayling.
Thank you, Mr. Speaker. Could I start by paying tribute to the excellent staff at Epsom Hospital Ministers to support those people, and particularly to get them back working as soon as possible?
Secretary of State.
Yes, Mr. Speaker, absolutely. It's incredibly important that we support NHS staff to get back to work as much as possible if they have been in an area where the demand has fallen. And because people have been not coming forward in the same numbers that they normally do for emergency admission, or they've been in a specialism where we haven't been able to undertake the work because of the prevalence of the virus. He makes an incredibly important point, and I can give him that assurance.
We now go over to Lucy Powell.
Thank you.
Lucy Powell.
Thank you. At present, only patients actually admitted to hospital with symptoms are being swabbed, leaving many with presumed COVID being discharged into the community. At the same time, only healthcare workers with current symptoms are being offered tests. Shouldn't the main priority now be to test all patients and all health and social care workers, whether symptomatic or not, given that after a month of lockdown, hospitals and care homes are likely to be the major transmission hotspots?
Secretary of State.
Well, Mr. Speaker, we are testing all the spread of the disease and stop it moving from that route as much as is possible. But on the broader points of expansion, absolutely, these are things that we're looking at. She makes good points.
Sir Graham Brady.
Thank you, Mr. Speaker. The Secretary of State is right in making sure that all patients being discharged from hospital to care homes are being tested. But there remains concern in the care home sector that normal procedures of assessment to make sure that patients coming to them or new residents are appropriate for the care setting. And because of emergency admission, this isn't always taking place. Before Easter, he very kindly agreed to look at the question of whether care homes could be indemnified or have some kind of waiver of liability in these circumstances. I wonder whether he has reached a conclusion.
Secretary of State.
Yes, Mr. Speaker, we are looking into that question, and I'll write to my right honourable friend as soon as we have an answer.
Caroline Lucas.
Thank you, Mr. Speaker. On contract tracing, I welcome the fact that he's working with experts in digital ethics, because if it's not run transparently by a public company with code open to public oversight and data anonymised, then people won't trust the system and it risks failing. But does he agree that only a community-led process of human contact tracing can provide the fine-grained and reliable data that such an app would depend on? And will he learn the lesson from the over-centralised organisation of the testing approach and instead adopt a more decentralised approach for contact tracing using local environmental health officers and PHE's regional outbreak management teams?
Secretary of State.
Well, Mr. Speaker, I agreed with the first 2 points, which is the importance of people for contact tracing as well as technology. And in fact, the two working hand in hand will be the most effective approach. I also agree with the need for the ethicists around this. We are giving up a huge amount of our liberty, all of us, because of social distancing. And so measures to reduce social distancing, for instance, through the use of data, need to be considered in that context. But we are making sure that that's done in a way that can provide assurance to people with concerns in that area. On the final point, we've got to make the appropriate use both of national and of local resources. In testing, for instance, organising drive-through centres across the country and home testing is inevitably an issue that needs to be done centrally, and then other testing laboratories are organised locally. It's about getting the best of both worlds.
Going across to Laura Trott. Laura Trott.
Thank you, Mr. Speaker. The sentence level is, and when, based on current modelling, we might achieve it?
Well, the current level of incidence is unknown until we expand testing yet further, but it is far, far higher than where it needs to be. Although, as I said, we are at a peak. And we have high confidence that we are at a peak in this disease, but obviously we need to see that come down. And it's a question of degree. The reason I'm not giving a numerical answer is because it is a question of degree. The fewer new cases, the more effective test, track and trace are as a way of keeping the disease down, and therefore the more of the social distancing measures can be lifted. This is all a question of degree, and we do not have an answer to the question of when that will all be doable, because we have not yet seen the curve start to come down, and we don't know the pace at which that curve will come down under the current social distancing rules.
Going across to Barry Sherman. Barry Sherman.
Mr. Speaker, can I just say to the Secretary of State, who I've known ever since he came into Parliament, I know he's been unwell, but he would expect me to be robust in my question. And can I tell him that as a Member of Parliament for Huddersfield, looking from the Yorkshire point of view, I think the management and leadership of this present crisis has been shambolic. I believe that we should never have been in the position where we lag so far behind Germany, a similar country to ours, and behind many of the other European nations we're predicted to be the worst. 823 people died. That's 2 jumbo jets of crashes. That's a large number. And the fact of the matter is, every time the Secretary of State speaks, he thinks it's a triumph what he's doing. I believe that it is a shambles of leadership and management. I think we're letting down NHS staff, and they have been let down. And indeed, I'm particularly cross and particularly angry at the fact that I understand that those early whistleblowers were so lent on and threatened with disciplinary action that was to stop brave young doctors and nurses standing up and telling it what it was like on the front line. Is that the fact? And can he get his act together? Because many of us do not believe that he's telling the truth to the people of this country.
Of State.
We want to be united.
Secretary of State.
Mr. Speaker, I think that the member who just spoke completely misses the tone and has missed the point of what we're trying to do as a nation to pull together in this time of grave difficulty. It is absolutely the case that our prime goals at the start of this crisis, to flatten the curve and to make sure that the NHS always has the capacity to treat everybody who needs it, those two objectives have thus far been met. Of course there are challenges. There are enormous challenges. Distributing 1 billion pieces of PPE is not straightforward. On the point he makes about whistleblowers, he is completely wrong to say that it is not possible to raise an issue within the NHS. By contrast, thousands of people do it in public and in private every single day. So it saddens me that a member of this House might get the tone wrong so badly. There are reasonable questions to be asked, and we try to answer them in a reasonable way, and I think that's the best way for this House to proceed.
We're going across to Sigurry Streeter. Sigurry.
Thank you very much indeed, Mr. Speaker. Can I put on record my personal thanks to the Secretary of State for his quite remarkable personal efforts over the last few weeks. I think he's doing a terrific job in unprecedented circumstances. And I welcome what he said about non-COVID-19 treatment earlier this afternoon. Will he, as soon as possible, please, set out a clear plan to enable elective surgery to take place once again in hospitals that do have capacity, so we don't build up a nasty backlog of unmet health needs? Thank you.
Secretary of State.
Yes, this is an incredibly important issue. We want to get the non-COVID-19 treatment back up and running as quickly, as safely possible, and of course putting in place the arrangements to make sure that when people do go into hospital without COVID-19, then they aren't infected by people who are in hospital with COVID-19. That segregation is a very important part of our considerations. The answer is yes, within very short order, we will start to restart the NHS. He talks about elective operations. That's an important part, but so too is people presenting themselves and giving people the confidence to call their GP, or if it's urgent, call 111 if they have a problem. Because we know, for instance, in cancer that early diagnosis is critical, and I want people who think that they've got a risk to come forward for that treatment.
Going across to Rosie Cooper in Lancashire. Rosie Cooper.
Thank you, Mr. Speaker. In a statement today and at the Health Select Committee, the Secretary of State has implored cancer patients to come forward and assured them of treatment. Yet since the Health Select Committee, I've been inundated with messages from all over the country from desperate patients whose treatment has been stopped, interrupted, or not even started because of COVID-19. So I would like to ask the Secretary of State what he's doing to ensure that there isn't a gap between his welcome words and what's actually happening. Can he guarantee that treatment will go ahead and give patients confidence that we've got COVID-free hospitals by frequent and widespread testing of staff? And finally, that ensuring death in service benefits will be paid to all healthcare workers who've died of COVID-19, both now and retrospectively.
Secretary of State.
Well, thank you very much, Mr. Speaker. I would just like to be absolutely clear, as I was at the Health Select Committee, which I thought was a very good discussion, about this point about cancer treatment. There is some cancer treatment that it is clinically inadvisable to undertake during an epidemic like this, because if you take somebody's immune system down to very low levels, then that puts them at significant risk. So I can't give the guarantee that all cancer treatment would go ahead, because even though we have capacity now in the NHS, and we have confidence that that capacity will not be overcapped by the by the virus is still at large in the community. So there are some cancer treatments that it is clinically inadvisable to undertake now, especially around immunotherapy. Having said that, yes, we do want people to come, and then we will treat them as best as we possibly can within the constraints of the fact that we have a very serious virus stalking the land.
Going across to Luke Evans.
Thank you, Secretary of State. Frontline workers in things like ITU and care homes are used to death. That's part of the job, but not on this scale and not in these circumstances. What is he and his department doing to support the mental health of frontline workers both now and in the future when the pandemic passes?
Secretary of State.
This is an incredibly important question. We've put in place a helpline for all frontline workers in the NHS to make sure that they have the support that they need, and I will make sure, working with the Honourable Member and others, I'll make sure that that support stays in place long after this crisis is over.
We're going across to Patrick Grady. Patrick Grady.
Thank you, Mr. Speaker. Will he... H.S. Nightingale.
I'm terribly sorry, Mr. Speaker. I don't recognise those reports at all. There is no impact at all of Brexit on our coronavirus response. And the good news is that we've had thousands of nurses and other clinicians come back into service since this crisis started.
Across to Kevin Hollinray. Kevin Hollinray.
Thank you, Mr. Speaker. Daniel Falouche, who's a professor of infectious diseases based in Shanghai, points to the fact that part of China's very successful efforts to control the virus was immediate quarantining, in that people go to a clinic, they're immediately tested, they wait for the results, it's a 15-minute test, and if that test is positive, they're quarantined there and then. Would the Health Secretary consider this as a potential for a very significant mitigation as we open up our economy against the chances of a second wave of this virus?
Secretary of State.
Well, of course, we look at all options. What I would say is that under the test, track and trace strand, of course, the policy advice on how people should isolate if they test positive is an important part of that. We have that advice currently in place, but of course test, track and trace really does rely also on self-isolation to make sure that it's implemented properly. Test, track and trace is about finding out who needs to take action, and then they do need to take the action that is currently set out.
We now come to the final question. Maria Riedel.
Mr. Speaker, on the 11th of March, I asked the Secretary of State whether it was right to allow over 3,000 Atletico Madrid fans to travel to Anfield to watch a Champions League game when they couldn't have watched their team in Madrid because attending football matches there was banned because it was a COVID hotspot. The Liverpool City region now has a higher than average incidence of COVID-19 than the UK and English average. The Mayor of Madrid, the Director of Public Health for the City of Liverpool, have both said it was a mistake to let the match go ahead, and the government's Deputy Chief Medical Scientific Advisor has said the idea that there's a link is an interesting hypothesis. Does he now admit that the government was behind the curve in banning such gatherings, and will he undertake to investigate any possible link between that match and the higher incidence of COVID in Liverpool?
Secretary of State.
Well, this is, of course, a question for the scientists, and what matters now is making sure that whether people are in Liverpool, across the northwest, that people get the treatment that they need and that we get the curve under control.
Order, order. That concludes scrutiny proceedings for today. Before suspending the House, I wish to place on record my thanks, and I believe the thanks of the whole House, for the commitment, the ingenuity of all those who have made today's proceedings possible. I can say almost everything has gone smoothly, but we will learn lessons as we do this more. Firstly, following remarks made yesterday in the debate on hybrid proceedings, I wish to explain how I will deal with points of order from Monday. Members must give notice of a point of order to my office before the start of sitting. If I am satisfied that the matter to be raised is a genuine point of order, the members will not be called to raise it. Instead, I will make a statement at the conclusion of scrutiny proceedings, setting out the point of order, the member who has raised it, and my ruling on it. I will now suspend the House for 15 minutes to allow members to safely leave the chamber and for broadcasting colleagues to make the necessary technical changes to our physical-only proceedings, and thank all who have taken part. Order! Order! Oh.